in the form of vignettes. So it's not a lot of jargon in there. So it's also a great resource for people. And it's funny, I think.
Great question. Yeah, Nate, do you have any podcasts?
So I listen to a number of them. A great podcast is Pain Science and Sensibility. It's more for clinicians. If you're hoping to learn more about this, it's from Sandy Hilton and Corey Blickenstaff, who are both physical therapists, and they will have other researchers, pain researchers on, and do like a journal review. And I think that can be really helpful. Do you know any more patient oriented podcasts, Natasha?
I do. I really like Tell Me About Your Pain. It is a podcast by Curable. Curable is an app that's designed for people with pain, and they have two people who lead it, and they often have patients with pain come on for the episodes, and they're usually trying to do some problem solving for that person. One of the authors also wrote The Way Out and has had a history of persistent pain himself too. So Tell Me About Your Pain.
And happy to write down those book titles as well. Yeah.
We'll get them for you guys. So we got a couple of them up there. We got the Greg Lehman Pain Science Workbook. We have the Why Do I Hurt, the Sense and Sensibility, Painful Yarns, and the Curable Tell Me About Your Pain podcast. I'll be happy to also just put those other book titles in as we're going along.
Yeah.
Nate, do you want to take that next one?
Yeah, good question. So a question about how long our classes are. We typically have hour-long classes. We have two different programs in the structured functional restoration program. There is a 3-day-a-week program in our monthly cohort. Those consist of 2 individual appointments and 1 group class. All 3 of those are an hour long. And then we also have a monthly program that lasts 6 weeks, and those are 1-hour appointments again with each discipline. It's helpful because there's the group classes is mostly didactic information, and so having the individual sessions does allow time for reflection and question and answer in case people don't have opportunities during the group class or maybe don't feel comfortable with it. It's nice to have time to unpack some of this stuff.
With the way that our program is structured right now, we have 4 people in each session. That is in part due to COVID restrictions with physical space limitations. Both Nate and I have only worked here during the pandemic, and so I do know that things were done a little differently pre-pandemic. Though some feedback that I've heard from some of my other colleagues is that they tend to find the smaller sessions work pretty well. Smaller number of people in each session, that is.
Four people.
Currently 4 people.
Yeah.
I have a question from Becca. What do you think people are worried about when they first start working with you? I'll say my assumptions. Nate, you can say yours. I think the primary thing that is most worrisome to people is that they are causing themselves injury. Not just that there's pain, because they already have pain, but that they're causing themselves physical damage. And if they start to do therapy and they experience pain during it, that they're actually setting themselves back instead of moving forward. So I think that's one primary concern. I think the other primary concern that I identify is there's just a lot of people that don't have hope that things can change, especially because usually their symptoms have just worsened over time, it's hard for them to see a way out, and that it can change.
I find too as well, many patients have already been to a physical therapist before and are concerned about being pushed far further and faster than what they're ready and comfortable with. So giving them opportunities to have ownership in terms of the pace of our exercise progressions or outlets is also really important in acknowledging to start out.
The next question is, how do you engage students in check understanding? There are two ways which I do. One is there's a questionnaire that we can use. It's called the Revised Neurophysiology of Pain Questionnaire. It is written by the Body and Mind Group, which is a pain research group. In this questionnaire, there's a number of statements which the person responds either true, false, or that they're unsure. And we can measure this at the beginning of our program and at the end of the program and see if they've made some gains in their pain biology knowledge. That is the questionnaire that was used in the study of the 800 people that I showed, where you saw their pain biology knowledge went up quite a lot in that first month. It was with this questionnaire that they measured that. The other way that you can check for their understanding is in the individual sessions, especially to ask them what their takeaway was. And that, prompts them to really reflect and put the knowledge that they've learned in their own words, and that really shows the learning. That also provides opportunity for some course correction if maybe they've conceptualized the concepts partially but not fully.
Really good question here. How do you talk about the brain being involved with the message of it being all in your head? And I think that's one of probably the biggest landmines that I hope to call out in our sessions and try and get around with. And I think it is tricky. In our group sessions, we do provide a fair amount of information and education on like nociceptive pain and different pain presentations, whether neuropathic pain, nociceptive pain. And I think having a foundation in like this is a neurophysiological process does provide a lot of validation for people. And it is something that I do check in with patients along the way of like, how is this coming across? Do you feel like this is, we're saying pains can be affected by emotions and relationships and environments. Is this landing in a way that feels like I'm telling you it's all in your head? And I think people appreciate that. And sometimes I say, yeah, this sounds like it sounds different, but doesn't feel different. And I think it's helpful to have time to talk through that a little bit and clarify. But I think that is one of the things I'm very aware of with this approach.
It's a great answer. I don't have anything to add.
Okay.
It is tricky and it can be done, but you have to be really sensitive with how you go about that. And then maybe I do have one last, it's just a lot of reassurance that their pain is real. Key concept number one, your pain is real no matter what mechanism is driving it. Another question from Becca. What do you see with people who are successful? Well, that's a fantastic question. I would say the things that I see are the people who come in ready to learn with an open mindset. That's the first thing, because we know that lots of people just don't know a lot about the changes in the nervous system. Like I said in the session, I graduated PT school in the last decade, and I did not learn about that. I learned a lot about other pain mechanisms, but not about nociplastic pain or the changes that happen in the central and peripheral nervous system as pain persists. So the people who are successful come in with an open mindset. They have often a lot of support. Their lives are really stable outside of the clinic, and they start to engage with the material through changing their function. We're very fortunate here in that we also work in a team setting with nurses, the physicians, pain psychologists, and occupational therapists. And together we are helping them not just learn, but make the changes to their habits. And usually through that, to use an analogy, the proof is in the pudding. They see it. Once they start to experience it, they buy in more, and they get that wanting to keep going with it mindset.
Yeah, I think it's a good answer. I don't have much to add to that.
Cool.
Another good question here about explaining graded activity
Mhm.
and helping patients pick a method that works for them. One of the frameworks that we use is called the graded stoplight framework. Tasha might have a link to that
Sure. Yeah.
as well.
Mhm.
And essentially it just classifies the things into like a green light, yellow light, red light, as you'd expect. But it looks at pain intensity. It also looks at some of the more like physical examination piece of it in terms of loss of strength, range of motion, and function. And so it's not just relying on the subjective experience. And the biggest thing we want people to figure out is ways to keep boundaries around pain. We give them permission to move, like we're telling them, hurt doesn't necessarily equal harm, and you can be sore but safe. But we do want to prevent frequent flare-ups if we can, and to start out with a small dosage and to build confidence with that, so that they know that they're not going to be in further danger. So this, if you're interested in the stoplight framework, I think is a helpful starting place. And sometimes it takes further individualization of that, but that's a good place to start. Do you have other thoughts on that question, Tasha?
No, I think it's great.
Okay.
We have another question. How much do you cover the autonomic nervous system in the classes regarding relaxation therapy? It's presented day one. Day one, we want people to understand how their stress affects their pain and their whole body. And so we talk about the parasympathetic system and the sympathetic system, the fight or flight response and rest and digest, the freeze response. And they're getting that information both from the physiology and the understanding of it, and then hopefully also through the lived experience as they practice the relaxation skills and they have that physical sense of their body calming down, their body relaxing, their breath slowing down, their heart rate slowing down. With the classes right now, there are some lectures that were pre-recorded for COVID. They are approximately 30, 40 minutes long, and they watch one lecture a week. And then they have, again, their individual sessions. Yeah, it's presented day one. We don't go too in depth, but we go in depth enough that they understand the physiology that it matters. To clarify, you're talking about the links for the relaxation lectures? I do not believe we can do that. Those are created for our patients that are going through the program. If I'm wrong, though, I think someone will tell me. Sorry, though. Yeah. There we go. Becca is our program coordinator, and we're not able to share those links. But again, thank you for that question. How to pick a graded activity. I can take that one, Nate, if you want.
Yeah, that'd be great.
Sure. So we ask the patient. What is it that you are not doing now that you want or need to be able to do more of? They pick the activity, not us. We will help them if they're not sure how to answer that. We'll dive a little bit more into how their pain's affecting them, and try to pick an activity that makes sense with what their goals are. It might be being able to sit for a longer amount of time, being able to be on the feet for a longer amount of time, being able to walk for a longer amount of time, lifting, carrying. We want to focus on functional tasks that are meaningful and relevant for that person. And then we have them, I can't recall if Nate mentioned this, but we have them identify their baseline amount of activity that they can do and be very confident that they won't have a flare up the next day. That is setting their baseline for the progressive or graded activity program. So from that amount of time, we're going to set them up with gradually increasing their activity. So they're able to gradually retrain the nervous system. Yeah, they pick it.
Looks like the main session starts here at 10:30. So I think these last two questions here about social support and alternative therapies might be our last two. Um, that question about helping patients with little social support, I think is a really good one. I do think that's one of the functions of the group class is that it does provide some sort of social support there. But I think, in terms of at home, that is a really good question. Natasha, do you have any thoughts on that?
Well, they are also in our program working with the pain psychologist. That person is able to help them, I would say more than PTs are, with social support. But we really do find that people that have limited social support, this is a lot harder work. We have our colleagues help us as much as we can with helping them establish social support, and that can be really complicated. But I'd say it's going to be really individualized to the person and their circumstance. It's a really great question, though. It's a really hard thing to answer.
Yeah, I've worked with groups in the past, and this is maybe a little bit different during COVID, but there are community support groups through Arthritis Foundation that provide spaces for patients living with chronic pain to talk about their experiences. And I think that's really key too, if people aren't having that coming in, and just being able to identify those community resources. But tough with COVID.
And then, yes, American Chronic Pain Association. Thank you, Becca. That's a great resource as well for social support. The last question that we'll answer today, what are your thoughts on the alternative therapies in addition to PT, such as acupuncture, naturopathy, etc.? I think they're awesome. I think that different approaches really help manage pain from its complex perspective. It's not, just diet, it's not just sleep, it's not just stress, it's not just inactivity. It's really a combination of all of these things affecting the person and affecting their pain system. And if we can get help on board through other disciplines, medical treatments, therapeutic treatments, that's only going to help us help the patient more. I think it's really key to make sure that we're balancing active and passive therapies. So if someone is just doing acupuncture, but they're not doing exercise, they may not see the success that they want. But if we can combine active and passive therapies and really treat pain from a multidisciplinary perspective, those patients tend to have really good outcomes. We have one last question, but I think we're gonna stop at this last one because we have to get to the next sessions at 10:30. So thank you all for your questions. We look forward to seeing you in later sessions today.
Thanks, everybody.